Welcome back, everybody. We're part of the Really Cool Humans Network. I'm Dr. Casey Oliver.
I'm Dr. John Hatch.
And we're down here again in the Neuroclinic. Thanks for joining us today.
Today we're going to talk about quick tips. What can we do? What can you do for different emergencies? And we're going to go through a few of them. We want you to be prepared when you need to endure a headache or need to get to the ER right away. What are some of the things that you can be aware of? What are things that you can do when I'm feeling motion sickness and car sickness and decrease that vertigo before getting to the hospital? What can you do if you're feeling nauseous? What do I do in a case of an instant concussion? What are the things I need to do right away?
Yep. So this is very important, obviously, because oftentimes if we miss these opportunities, if we miss these signs and symptoms of emergency, sometimes it can be too late, and it gets pretty scary for a lot of people. I lost my own grandmother to a stroke. And so one thing that I want to touch on first of all is what we call the 7 Ds of stroke. Now I wrote down a couple notes here and we're going to touch on these. The first D is detection. What are some things you can think of as like detection of stroke? Numbness, confusion, changes in speech. The numbness you might feel in your face, it could be in your arm, it can be in your leg. If you feel an acute sudden onset of numbness and tingling on certain parts of your body, confusion, speech, that's detection. So that's the first D. Number 2 is dispatch. What you got to do if you experience that type of symptomology is call 911 immediately and get the emergency vehicles there to the home or wherever it is that you are, because that ambulance needs to take you to the hospital right away. So delivery, that's the 3rd D. That's very important because you've got to get to the hospital because you need attention. Number 4 is door, which means that at the door at the hospital, the emergency dispatch needs to know what you're going through so that they can receive you and give you the proper care as soon as you get to the door. Number 4 is data. We need to measure the severity of the stroke. If you've ever been in a car accident and you've requested that ride to hop in the ambulance and go over to the hospital, almost always they will run you through a CT or a CAT scan. The reason they do that is because that's one of the best diagnostic methods to see if you are experiencing any type of bleed or a stroke in the brain or any type of hemorrhage. Number 6 is decision. So you're going to be presented with treatment options, and that's always important when you're making these types of decisions. So the 7th D is drug. Oftentimes they're going to use fibrinolytic therapy to help relieve the symptoms and the severity and what you're dealing with the stroke. So that's one of the things we wanted to talk about today was stroke, how to detect it, what you're looking for, and then how to just jump right in and get to the hospital.
So a couple of those with that first D, the detection, you'll look for confusion, you'll look for stumbling, you'll look for dysarthria, which is the inability to speak.
It'll sometimes come out garbled. That's a word that we use, garbled speech.
Yeah. Pain, pressure, headaches. Now with headaches too, the important thing, like we mentioned before, is if the headache, and this can come with a stroke too, because this could be an aneurysm stroke. If you're having a pain like you've never experienced before, and it feels like it's going to rip the top of your head off, you get to the ER immediately.
Yeah, that's definitely one thing that we learned about headaches, because as chiropractors, people come see us a lot of the time for all different types of headaches. The most common type is the tension headache. We've got rebound headaches, we've got migraines, you've got cluster headaches. That headache that you've never felt before and it feels like your brain's just going to explode, oftentimes is definitely a sign of stroke, so you want to get in there. Another thing worth mentioning, we went to a seminar once with Dr. Datis Karazian with Apex Energetics down in San Diego, and he talked to us about a condition called lacuna. And we often, I've actually have a few patients I'm working with right now that are dealing with this. It's a circulatory issue in the brain that it's what we call silent stroke. And so what we've learned is that the symptoms associated with silent stroke is almost like an absence seizure. If you're familiar with any seizure type activity, absence seizures is kind of like you just drift off into that space and you're daydreaming and you kind of just space out. But the important thing is to note if there's any really acute bouts of anxiety that follow that. That's very closely associated with lacuna, or what we call silent stroke, and it's important that we address that, and that's something that we can do here in our office.
So what other things can you do when you're out there? Now that we've talked about stroke and headaches, with that comes nausea. A lot of times you get nauseous or the feeling that you're moving. One of the best things we find if you're feeling nauseous, gargle. Stop, take 20 to 30 seconds and gargle water. Doesn't have to be salt water, doesn't have to be a drink or soda or anything. Get some water, gargle for 30 seconds, and see how that nausea comes. If the nausea increases, get to the ER right away. If the nausea decreases, you might just have a little bit of vertigo, you might have a little different wind up in the brainstem, and you might be okay.
The reason why that's important and why it works is because really what you're doing when you're gargling is activating these deep throat muscles. And what that does is it fires up the cranial nerve called the vagus nerve. The other ways to do that, if you enjoy singing, you can sing really loud, activate those deep muscles. That's why we advise our patients to gargle, because it's a very non-invasive way to activate the vagus nerve.
Absolutely. And also, when you're feeling that bloated, when you're feeling heartburn, take away the nausea. Now we're dealing with heartburn. We're dealing with bloatedness in the gut. You eat a meal and you're like, oh, my food's not digesting. Gargle. This time, instead of for 30 seconds for the nausea, for an entire minute. When you're using that gargling reflex, that's cranial nerve 9 and 10, you will create more gastric juices and get your body to break down the food that's bloating your stomach, if it's not a food allergy or other things.
So, quick tip, let's touch on heart attack or cardiac arrest, any type of cardiac event. What you're going to look for is chest pain. It's going to feel like an elephant, oftentimes is with what we learned as we were going through school and all that fun stuff. It feels like an elephant is stepping on your chest. So you're going to feel increased massive pressure on the thorax up here in the chest. You're oftentimes will get radiating numbness that comes up into the jaw. And most of the time it is on the left side. It can happen on the right side, so be very aware. If you feel that type of crushing chest pain that shoots up into the right jaw, that can also be a cardiac event. But most of the time it is into the left side. Numbness and tingling that actually goes down the left arm as well as the jaw. That's an emergency. Call 911, go to the hospital. And oftentimes what we'll advise there is it's actually been recommended, is if you look at some of the recent literature, it's not recommended to take a baby aspirin every day anymore. But in that case, if you feel that crushing pressure on the chest, the numbness that goes into the face, down into the arm, take an aspirin. It's a blood thinner, and it's going to spare you some time.
So next, low back. You throw your low back out. You sneeze, your back goes out. What are you going to do? There's ice, there's heat. Every remedy that's out there, we're going to show you a quick little tool that you can use to decompress that spine until you can get into see your orthopedic surgeon or your neurosurgeon or a chiropractor that might help you in that spinal decompression. So let's show you. Everyone at home has a broomstick, okay? And this broomstick is one of my favorite things whenever we're talking to patients with chronic low back pain that have an instant injury. And I'm going to show you how to use it right now. So let's do it. So here we are. We're laying on our back. We have the broomstick. We just threw our entire back out. We're probably on the couch. We might be on the floor depending on where it happened. What you're going to do, and it's going to be painful to move those legs. So if you need someone to help you bring your legs up, bring your legs up. What you're going to do is you're going to put this broomstick underneath your knees here. Now, you rest it. You use your whole torso, your upper body, to pull your knees towards you, creating a negative pressure in your spine, helping that disc, and then you just bring it up, let go. Bring it up, let go. You just bring it till your glutes just come off of the pad. You don't use your abs. It's not an ab crunch. This is just a spinal decompression. You hold here, you bring up, hold, and then drop back down. Bring up, hold, drop back down. And the negative pressure, this is what you're doing in an acute scenario, and you can do this about 50 times, okay? And you just bring it up. There's no ab contraction, no leg muscle. Everything's done by your traps and your arms. And that should alleviate quite a bit of pain in that lower back.
Movement movement is essential, and this is why this is so beneficial. Oftentimes when people say I've thrown my back out, really what that means is there's little spinal, basically the intrinsic muscles of the spine, or the teeny little muscles like the multifidus and the rotatories. Those are non-volitional movements, or you cannot control those muscles if you want to. So you make a wrong move, oftentimes what that is a sprain or strain of those muscles. And movement is key. You got to keep moving, and that's why this type of decompression and this type of movement helps so much when you throw your back out. And he knows what he's talking about because he broke his back this year snowboarding. So he had some low back injuries for sure.
Alrighty, thank you for joining with us. We really appreciate your time. We hope these quick tips help you.
And hopefully it never happens, but we just wanted to give you some quick tips in case of emergency. So like Dr. Hatch said, we really appreciate your time. Thank you for tuning in with us. We're Dr. Casey Oliver, Dr. John Hatch, and we're here at the Neuro Clinic. Check out our website at theneuroclinic.org, or you can always contact us by phone, 801-766-6580. Thank you.